Hey, Viva Lifers. This is Dr. Kelly OMD, and we are here for another evening of Ask Dr. Kelly OMD. We have a special guest tonight. Her name is Dr. Ebony Hoskins, and let me tell you how much of a superstar she is. Not only did she graduate from the Xavier University of Louisiana in New Orleans, she is also an OBGYN and a board-certified gynecologist, oncologist. So this is a rare treat, and we are so happy to have you. Dr. Hoskins, go ahead, take it away.
Hi. Hey, everybody. Thank you so much for the invite. I'm looking forward to providing you with some tidbits about cervical cancer and a little bit more information about the causes of cervical cancer. So I will do a brief presentation and I don't have many slides, maybe just one to present tonight. And then I really look forward to having some discussion or conversation about anything that you want to talk about related to cervical cancer, of course. So you may or may not know the most common cause of GYN cancer is cervical cancer. In the United States, nearly 14,000 women will be diagnosed with cervical cancer, and approximately 4,300 will die. And so as you look over time, the biggest factor, if you will, to decrease the risk of death has been Pap test. And then most recently has been HPV test. We'll talk about that. Now, the interesting thing is HPV is the cause, I would always say, anywhere from 95 to 98% of cervical cancer. And there are approximately 150 types of HPV subtypes. It not only causes cervical cancer, but it has also caused anal cancer and mouth and throat cancer, which is also on the rise. The average age of diagnosis is age 50, and that kind of ranges between like the so the other thing about cervical cancer is there is a pre-invasive lesion, which is called CIN2 or 3 or cervical dysplasia. So when we get Pap tests, we're looking at the abnormal cells on the cervix. We're also testing for HPV, and that will prompt whether we need to do a more diagnostic test. So the Pap test is screening test, HPV is a screening test, and then those tests will detect or determine if we need to do a diagnostic test. And that's when we do procedures, and I didn't get into huge detail, where we take biopsies and maybe even remove parts of the cervix to determine if there's any pre-invasive lesions or dysplasia or cancer, and hopefully not. One tidbit I want to relay to you is approximately 20% of women are age 65 and above with cervical cancer. And you may hear some primary care providers that say, hey, after the age of 65, if you've never had any HPV or abnormal Pap smears, you don't need to come back for a Pap test. And I have diagnosed several women who were, say, age 70, who had not had their Pap test because the doctor said you didn't need to Pap test, and they actually had cervical cancer. And so I think it's very important that women age 65, or mature women age 65, still at least go to have a pelvic exam, or at least be seen maybe every other year. I know Medicare doesn't always cover that, but there's something to keep in mind. Other tidbits that we wanted to talk about tonight is Black and Hispanic women have a higher incidence of cervical cancer, and that's actually worse mortality. And there's numerous factors. Some of it is thought to be whether it's access to the test, whether they're insured, kind of follow-up. I actually have a patient currently who is a young woman, and I will tell you the biggest, she has an advanced cervical cancer, and what kept her from the doctor wasn't insurance, it was fear. So I think we have a lot to do in terms of, talking about it, educating, even talking amongst your friends, educating, that's a form of peer education, if you will. And her, fear. And she's actually in the hospital right now, even though we treated it, and it's progressing. And so it's very important that we talk about it and make it a norm, and at least maybe even accompany a friend if they say they're fearful about the diagnostic test and all of that. You may recall, we used to say, go get your Pap smear every year. And now that has changed with the addition of HPV testing. So remember, I said the cause of cervical cancer, majority of the time, is HPV. And so now we use the HPV and the Pap test in terms of screening. So women who are age 21 or less are not advised to actually get any HPV testing or a pap test, because the thought is that they're more, if they're sexually active, more likely to actually have HPV and more likely to clear the HPV. And then when we look at data, they say 0.1 per 100,000 women at that age will get cervical cancer. So the risk is quite low. We start screening cytology alone. That just means doing the actual pap test, not HPV, at the age of 21 to 29. And that's every 3 years. After that, it gets all confusing. I will admit it, very confusing, but I'll tell you, age 30 to 65, the recommendation is a pap test every 3 years. And then really kind of the gold standard, in my opinion, would do a pap test with HPV test. It's something that's called co-testing. And I would encourage you to make sure that your doctor has ordered it, because it takes a while for doctors to adapt new recommendations over the years. Yeah, so these basically, and then see how it says age 65 to stop screening if 10 years of negative results and no history of high-grade dysplasia. And if you see that where it says grade D, that just means kind of the, the type of data that was used for that recommendation. I would say it may be population-based and like how it's funded, but I would strongly encourage any woman after the 65, if they still have a uterus and cervix in place, to still at least be seen by their primary, really OBGYN or GYN or primary care if they are comfortable doing those tests, at least for an exam and discussion. I think the other highlights to keep in mind before we start opening up is to talk about HPV vaccine, which was something that was not present, say when we came up growing up. But the HPV vaccine is readily available for young children's boys and girls, young women, young men, and actually it can go up to age 45. So I think it was probably maybe 2 years ago, and I would see these women come in, and I was less than 45, and I actually started the HPV vaccination. So just something to think of mind if you're at that age. If beyond that age, listen, we can still encourage others, our children, and at least a discussion. I think it's worth a discussion to talk about.
So would you say, like, if you are having sex with a new partner, then that would be the time, especially as we mature and we understand that the divorce rates are, greater than 50% in certain populations. And so people have new partners, or maybe somebody passed away and that's why they have a new partner. Would you recommend that in people that are more mature past the 45-year-old range, definitely having the conversation and potentially getting the vaccine?
So so that one's a iffy one, because the vaccines were approved for women up to 45. I don't think that it would even be available for purchase, if you will, for an older population, because it wasn't studied in the older population. But I definitely think for women where the primary doctor is like, no, you don't need a pap smear, they probably do. And I've seen older women had new partners and they've had high-risk HPV, require colposcopy and all these procedures to prevent a cervical cancer. So I am a big proponent of at least, maybe Medicare won't pay for it every year, but every 2 years if you can.
Yeah, totally. All righty. So thank you so much for your presentation. It was, succinct and exactly what we needed.
Yes.
Talking about the HPV screening. So screening for abnormal cells on our cervix, as well as the HPV specific screening test. Could you talk about that a little bit?
So the HPV specific screening, I think it's supposed to be a little bit more sensitive than the actual pap test. So I've seen women, normal pap tests, HPV positive, go on to do what we call, remember we talked about diagnostic testing, meaning we take a closer look at the cervix with a microscope, colposcopy, and then we may biopsy. And I've seen women, not to scare anyone, but detect a cervical cancer that way.
Absolutely. And like you said, there's more than 150 and some say 200 different subtypes of HPV. So we know that if you get vaccinated, you're not going to actually cover all the types, but vaccination does cover, especially the 9-valent vaccine, covers the highest risk and the most prevalent high risk types. So that is truly an option for you. All right. You're having these conversations with your children, your grandchildren, or at least your children as their children are starting to come up. We need to have these conversations because we do not want to go back to what happened in the past, which was, which was cervical cancer was like one of the #1 cancers that women were dying for at the beginning of the 19th century. We've come so far with decreasing the amount of cervical cancer that is, as far as a burden on, here in the United States. In other countries or in areas that have low socioeconomic status, this is still quite prevalent. It is quite prevalent. All right. Dr. Hoskins, how do we get in touch with you if we are interested in making sure that we refer patients to you or somebody needs or wants a consultation with you?
So I am in Washington, D.C. at MedStar Washington Hospital Center. I think I'm happy to share my information with you. Most of the time, most patients come either referred by their OBGYN or primary care doctor with a diagnosis or problem beforehand. We do see some second opinions, if you will, if they're, kind of appropriate, if, new cancers, uterine cancer, or if there's any complex GYN issues, we're happy to see. So I'm happy to share that information with you.
That information if anybody ever needs it. And, this is my #1 referred to. And I say to people, if you need to fly in for a great doctor, then fly in for a great doctor. People do it all the time, and we should do the same thing where we know. All right, y'all. Thank you so much, Dr. Ebony Hoskins, for being on here. And as you know, this is Dr. Kelly OMD. Ask Dr. Kelly OMD is on every Monday at 7:30 p.m. Eastern Time. And we will have recorded sessions if you're involved in the Viva Life Health Hub. You can find me at DrKellyOMD, as well as drkellyomd.com. Have a wonderful evening. And don't forget to do what? Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.